audible? So, friends, today we are studying the continuous series of studying the book of J.H. Clarke, the prescriber, third edition. Uh, in the beginning of this book, we have already studied few lines. Today we are reading point number 5, the scope of clinical repertories. The scope of clinical repertories. The prescriber was designed primarily for the beginning in the homeopathic practice by one who had felt the need of a work of the kind when he became convinced of the truth of the homeopathic law. As all British homeopaths received their training in allopathic schools, it is inevitable that allopathic ways of looking at things should be to a large extent prevail for some time after their graduation or conversation. In the old school textbooks, remedies are considered in the relation to diseases. In homeopathy, remedies are considered first and foremost in relation to individuals. In homeopathy, when the cardinal symptoms of a remedy are marked in any case, the name of the disease the patient may be suffering from is no weight whatever in determining either for or against the selection. The remedy which corresponds to the symptoms of a patient must be given, and if the case is curable, it will cure. To give an example, I may relate a case as it was told to me. A patient suffering from pneumonia had gone from bad to worse under homeopathic treatment based on nosological lines. When it was decided to call in further help, the consultant, on entering the room, observed the patient shrink away from him in great fear. He found him collapsed and cold, with cold sweat on his forehead. He said to the other attendants that he would take their word for all the rest of the patient's symptoms. There was no medicine that would cure the patient, and one only, and that was Veritrum album. And Veritrum album very speedily did. Veritrum had not given in the case because it was not recognized by those in attendance as a pneumonia remedy. In a very severe case of pleuropneumonia of my own, I rapidly cleared up all the dangerous symptoms with stramonium, to which I was led by the delirium of the patient, in which he saw animals about his bed and especially a large black dog. The patient was a youth and there was no question of alcoholism in the case. One of the best cures of rheumatic fever I never made was with Ignatia, which was given because of the mental commitment in the case. I mention this instance to show that however valuable clinical repertory may be, It can never be par- paramount in homeopathy. The whilst the prescriber may seem to justify the allopathic arrangement of medicines as remedies for disease, I only offer it as one, and that the most elementary of the method by which the similar, that is to say, the homeopathic remedy may be found for a clinical or nosological repertory is perfectly justifiable from a homeopathic point of view, provided its limits are clearly understood, names of diseases correspond to well-defined group on the symptoms, record of various medicines. The prescriber shows at a glance what these medicines are and how they are to be distinguished from each other. Thus, in a very large number of cases, a closely similar, if not the most similar remedy may be found. But whilst offering this prescriber as a most natural step in homeopathic practice to all the allopathically trained mind and as a convenient remembrance to older homeopaths, I wish most strongly to insist that readers shall take themselves superior to it and independent of it by a thorough acquaintance with the materia medica and by making themselves proficiency in the use of symptoms repertories. Classical works like those of Bale on diarrhea, A.C. Allen on intermittent fever, Minton on uterine therapeutic all give elaborate and detailed repertories of symptoms compiled on a clinical basis, enabling the reader to find by their means the most similar way remedy. The scope of the prescriber does not permit of my doing this in respect of to all diseases. But I have adapted from hearing His Excellence repertory to toothache, which has often enabled me to find the remedy. And I give this in its proper place as an example of the kind and as an exercise for junior homeopaths in the use of the most advanced method, although primarily arranged as a repertory for toothache, is equally available for neuralgic pains affecting the face and head, whether connected with this disease of the teeth or not.